Hi, my name is AshleyMorse. I graduated from the University of Maryland. I studied government and politics. I'm currently a student completing my nursing school prerequisites, and I also work as a server at a restaurant. I don't think that there's a single definition that could encompass every aspect of the role of a nurse. A nurse tends to those who are ill, but in order to do so, a nurse needs to be a teacher, explaining each procedure, why it's being done, and how it's going to help the patient. A nurse needs to be a friend. They need to be an emotional support system to help a patient cope with any suffering or distress. And that not only goes for the individual receiving care, but the friends and family involved as well. And a nurse needs to be an advocate. They need to speak on behalf of their patient, especially those who can't communicate for themselves. It wasn't just one moment that helped me realize that this was the profession for me, rather, a series of experiences I've had over this past year. What initially sparked my interest in nursing was observing the nurses at Children's Hospital Center when I went with my cousin for his chemotherapy treatment. Then riding the ambulance for the College Park Fire Department, going on different calls, working with different types of people, different patients. It didn't matter. I felt such satisfaction just knowing that I was helping these individuals, and that really confirmed that I wanted to go into the medical field. The biggest aha moment I think I have had actually happened pretty recently. My grandfather's in the hospital suffering from sepsis. I've gone to the hospital to visit him every day, and I've actually helped the nurses feeding him with his physical therapy and at times having to urinate. I really got to exposure to the less glamorous aspects of nursing, but it didn't deter me at all. It made me feel great that I was able to help someone who was incapable of doing it themselves. As an EMT, obviously, get to interact with emergency room nurses on my shifts. I've taken the opportunity to ask them questions and learn my way around the emergency room a little bit more. My aunt was a nurse at Washington Adventist for 26 years, and now she's the head nurse at Hillhaven. It's a nursing home and rehabilitation center. So I've gotten to shadow her, see like her tasks on a day-to-day basis, work with some patients. So I've kind of dipped my feet in geriatric nursing. Everything from helping a man after a hip replacement to the Alzheimer's ward. So that has been a very eye-opening experience for me. Have I seen a nurse that exemplified this professional role? Absolutely. I discussed in my personal statement about the nurse that helped my cousin with his chemotherapy treatment. She was amazing, and honestly, as cliche as it sounds, a real inspiration. She explained every procedure and what was being done in a language that my 8-year-old cousin could understand, made him feel comfortable. And then she went beyond her responsibilities as a nurse, took the family aside, and explains the behavioral changes that Brent was going to experience, how he's going to demand more parental time and attention, and that could have an effect on his siblings as well. She explained that we need to get into habits and build a routine to help him cope with the treatment. Her behavior really exemplified that she genuinely cared about the patient on more than one level, and how their home life was, how they were doing in school, and she made a remarkable difference for my family. My grandfather had open heart surgery last December at Washington Hospital Center. When he was in the ICU, two of his nurses were actually Georgetown graduates, so I had the opportunity to discuss the program with them a little bit, and each of them had nothing but positive things to say, both about the courses and especially about the faculty. They admitted that it was extremely stressful and difficult, but that they felt very prepared when they finally were on their own in the hospital, and that was so important to me. It immediately made Georgetown my top choice. Then when I began researching the program myself, I saw the 100% pass rate on the NCLEX scores, and that's just a testament of what a great program Georgetown has and how it's something I definitely want to be a part of.